Many years ago, I decided to rebrand our clinic after about 15 years in practice to emphasize something more along the lines of what we were treating in day-to-day practice, which was more joint-related problems. And that most of that is geared towards spine, even though we do a lot of sports injuries, for example, extremity type of injuries, shoulders and hips and knees. However, the majority of what we see day in and day out is spine. So I wanted to put those two words together, as well as the word action, because we've always had action in our name from day one. And we use action to emphasize that's what we're trying to do. Not only take action on the front end, but get people back into their quality of life and normal daily activities by taking action, so you end up with more action versus less action. So action, spine, and joint is where we came up with that name. Just really the privilege and honor to really be able to be entrusted by so many people with their number one asset, that being their health. And so we don't take that lightly, and we try to make sure that that feeling is conveyed to each and every patient when they enter our clinic versus when they leave the clinic as well. Well, I want them to feel at home, like they're sitting in their own living room, versus a cold, white lab jacket, standoffish type of medical atmosphere that so many people unfortunately are used to experiencing when they go to any kind of healthcare provider. Well, I would like to think most people end up in our front door by a referral from their friends and family, pleading with them to do something that doesn't require downtime, invasive procedures, and very dangerous procedures, not to mention expensive procedures before it's too late. People unfortunately wait till last minute before they put their foot down and get mad enough to take action and do something about it. So I would say that the thing they underestimate the most is the implications of how it's really eventually going to catch up with you and affect not only you in your day-to-day life, but those that depend on you, which are your family and friends. So many people that have come into the clinic over the years with true quality of life issues, facing a back surgery. Many of the people who've had actually the back surgery scheduled, they weren't ever told that they had any other options, or perhaps they felt like they truly had exhausted all forms of conservative management when they didn't realize what was available to them. There are way too many options out there that people simply are not aware of, and it's our purpose to simply make sure that we do everything on our end from a community point of view to make sure that that awareness is out there, whether that be with their online research or when they come in our front doors, to really explain what their options are. And unfortunately, we can't help everyone, and we know that. And so we've geared our systems and protocols in our clinic to be conformed around the fact that patients do have options, and unfortunately they have a lack of understanding and lack of information when they come in. And so fundamentally, it's our objective on that first day or second day when they come in to give them a synopsis of a lot of options they didn't know they had. And in so many cases, they're very enlightened by those options when they discover, why didn't someone else tell me about this before? After 40,000 patients in our clinic over the years, rarely do we run across someone who had a successful back surgery when it's been 10 years or longer out. Studies show that the average person who has one back surgery will have 3 over the course of 15 years. I mean, look at Peyton Manning and Tiger Woods. Each of them are going on their number 6th surgery, and they're still having the same quality of life issues and career ending in some cases. Well, you have to wonder, if the first, second, or third surgery didn't do the trick, why would the 4th, 5th, and 6th one? I can think of so many patients over the years who came in as a last resort, and they were actually scheduled for surgery. I've got a couple under treatment right now that they're trying to cancel that surgery. We approach complex pain from an approach that's obviously non-pharmaceutical, non-surgical, and in doing so, we always tend to gather the other records that the patient has had before coming to see us, because we want to know their comprehensive history. And that allows us to determine, number one, really if they're in the right place, if they're truly a candidate for what we do. What separates us really from any other clinic down the road is we have focused over the years on specializing in one or two specific specialties versus a general approach to a cascade of issues that so many clinics tend to have. I personally have spent my time, effort, and energies over the past 30 years drilling down and making sure that we bring our level of expertise up as high as possible at treating the specific conditions that we treat, which are disc-related, spinal disc-related pathologies and traumatic injuries, whether that be from sports injuries or motor vehicle accidents or on-the-job type of injuries. And so we take more of a specific approach based on our history of our studies and research and just experience with thousands of different patients. And we also work with other specialty physicians around Middle Tennessee in case we need to co-manage that with a surgeon or a pain management physician. So we understand what it means to stay in our lane, but yet offer that patient viable options on the front end so that they can make a more appropriate decision on the back end with their family members as to the best route to take before going down a road that they simply can't turn back with. Spinal decompression has been around for 20 or 30 years in some form. There's a tremendous amount of research behind spinal decompression, and there's all kind of different machines with different bells and whistles and technology. But fundamentally, spinal decompression is designed, and the reason it works so well is because it's fundamental, but it's designed to treat a mechanical problem with a mechanical treatment. Spinal decompression allows us to address the root cause of their problem, which is usually a deep down mechanical lesion or contusion of tissue, whether that be from a trauma, a sudden trauma, or repetitive trauma over the years. The ideal candidate for a procedure like spinal decompression would be someone, first and foremost, that fundamentally understands that this is going to be a route that may not be overnight. This is going to be something they're going to have to take more of a lifestyle modification and a rehabilitation approach versus just a kind of a quick fix like you would with an epidural steroid injection. And once we can get over that hump, we can go into the next phase with the patient really just kind of trusting the process and believing that it's going to work for them. We've got a ton of baby boomers hitting the retirement age that want to stay out on the tennis courts and golf courses whenever they're well into their 80s, doing what they do, playing sports, doing lively things, just lifting their grandkids or going to Disney World and walking 5 miles a day. People genuinely want to do that compared to their ancestors sometimes that just succumbed to the fact they were getting old and they turned it in. Well, most people that come into our clinic, they've tried stuff like physical therapy and cortisone injections. And unfortunately, those things still at the end of the day, they're just treating the symptom on the surface. They're not getting to the root cause of the underlying reason that they really got to that position in the first place, which could be a simple misalignment of the joint. Same thing can happen with your car. Your car misaligns and it's going to create a slow, insidious cascade of issues down the road. Well, you can learn to live with it. You can just ignore it and keep driving. But at some point, by not treating the underlying cause of what created the problem to begin with, you're going to pay for it. And in so many cases that come into our clinic, they've tried the physical therapy and it did work for a while. But now, since it was just a Band-Aid and did not correct the underlying structural problem, it's back. And in so many cases, it's back with a vengeance. multiple times worse than what they started with. I would like to see Action Spine and Joint remembered for serving the community at the highest level of integrity possible. And if we achieve that for the vast majority of the people that we deal with, then we've achieved our objective. And my personal goal as a whole, and you can't please everyone, we understand that, but 98% of them, we would be happy with that.